Hello everyone, hope you're all doing well. We will talk about H. pylori, the Helicobacter, and its relation to the stomach cancer, or we call it gastric cancer. Actually, one of the things that annoying and depressive, patients come to us and already complaining of some kind of gastric issues or been neglecting that gastric symptoms for months or years. Then he comes suddenly, and when he check, he will find that he or she having stomach cancer. Because the symptoms of the stomach cancer is vary. Could be difficult of swallowing, could be for sure unintentional weight loss, heartburn, bloating, indigestion, or other related digestive system symptoms. What will happen actually, and why we highlight this when we talk about the H. pylori? Because it was found that H. pylori, the Helicobacter, this bacteria, the bad bacteria, which lives for thousands of years, it's found to be very correlated to the peptic ulcer. So the bacteria, it has the ability to make some ulcer or hole in the stomach lining, and that can be proceed to make some abnormal growth, which we call it cancer. So the thing start from this bacteria. So we try to prevent this stomach cancer by preventing the happening of the bacteria. Okay, you will tell me, what are the symptoms of the Helicobacter bacteria symptoms? It's actually plus minus the one that I have mentioned to you, if it is present, because in most of the cases, Helicobacter patients, they don't have any symptoms. But if they have, they will have also heartburn, bloating, unintentional weight loss, nausea, burping. All of these are the symptoms of the H. pylori. So if you have these symptoms, please don't simply take over-the-counter medications like the antacids or Gaviscon or others to release your heartburn or your bloating. Try to consult a GIT specialist, means a specialist in the gastrointestinal system. Because if you ignore these symptoms, you might end up with stomach cancer or gastric cancer. Gastric cancer, how to be diagnosed and how to be treated? Okay, actually, it's diagnosed by endoscopy. So your specialist will do an endoscopy. They will insert a camera with a tube and to look into the tumor. They will take a sample and they will send to histopathology for analysis and to know what type of cancer do you have. Actually, there are two types of cancer, either in the upper part, which is near to the esophagus, or to the other parts of the stomach. Treatment depends on which part is affected. So they might have excision only the tumor itself, or they will cut part of the stomach or the whole stomach. So it's a serious thing. That's why you need to pay attention, please. If you have any GIT or some digestive system problems or symptoms, please pay attention and go and visit your specialist to check why you have this recurrent or these symptoms of the digestive system, heartburn, bloating, indigestion, and so on and so forth. Second, you do some regular checkup. It's not a problem to do a urea breathing test to check whether you are having the H. pylori or not. Or you need to take something to reduce the load or to help you to eradicate the Helicobacter infection. And we advise to go for natural thing like the Gut Plus probiotic, which has the Lactobacillus sakei probio 65, and this one is very effective to eradicate the H. pylori from your stomach. It works with something we call it the lock and the flush technique. So this probiotic is very clever towards the H. pylori. It will go and search for the bad bacteria, the H. pylori, it will find it, detect it, catch it, because it has some molecules on the surface. It will adhere and stick on the gut plus, adhere, and they will take it out from your digestive system. So it is very natural, very safe, no antibiotics, no side effects. Result is very proven because it is clinically tested, means it's been tested with what we call with patients, real patients, and they found a very nice result over the use of 2 weeks and more. These things can be used for more than a month, 2, 3 months, 6 months, and more. There is no harm to use it for long because it will not affect the balance of the bacteria that we have. So, in a conclusion, H. pylori is the main cause of stomach gastric cancer because it is the main cause of the peptic ulcer, and it is very well known. It is a risk factor, plus other risk factor like eating very salty and very smoked food, smoker, if you are a smoker, hereditary family history, you have a stomach cancer, you are at higher risk of getting what we call the stomach cancer. But H. pylori was recognized as the main cause for stomach cancer. So what we call prevention better than cure. So you better do prevention, you get something natural to eradicate your Helicobacter load, and then you will end up with some peace of mind. You can do some regular checkups to check whether you have the Helicobacter or not, whether you have an ulcer or not. So it's best to be on the safe side. Wish you best of health and take care.